Hello everyone, welcome to Dr. Osman's Edu Trends, Swing into Educational Trends. Today I am here with details on coronavirus, a disease whose outbreak has become a challenge for health professionals across the world. Maybe you all are searching answers for important questions related to the present burning issue, that is coronavirus. There are many questions, confusion and fear in everyone's mind. If you too have questions related to coronavirus, then continue watching this video. World Health Organization has declared coronavirus as an international emergency. The coronavirus is the world's largest virus to be banned, as the spread of the virus is everywhere across the world. Till now, more than 20,000 cases were reported only in China alone, and this virus has infected around 90,000 people all across the world. More than 3,000 people have died due to this virus, and number is increasing like a time bomb. As the widespread is more, people have many questions, confusion and fear in their mind, like what is coronavirus, how it is transmitted, who are prone to get affected, is there a treatment for this disease? As I mentioned before, till now thousands of people got under the tight nexus of this virus, and several have died, and the numbers are still increasing. Scientists claims that this virus has started spreading from a sea animal market in China in the city called Wuhan. This market is very famous for illegal business of wild animals like snake, raccoon and porcupine. These animals were kept inside the cage and they were used as food and medicines. China is a very big supplier of wild animals, from where the legal and illegal business of sea animals was functioning since several years. According to World Health Organization, the main reason of virus transmission was maybe due to the consumption of bats as food. It is also claimed that before getting transmitted into humans, the virus may have entered an animal whose identification is still under investigation. According to an investigation done by an international agency in China, wild animals were consumed due to their belief in wild taste, and they even believe that it's their right, and few animals were used in preparation of medications. There are several hotels and restaurants in China where bat soup being served as food. Also, the soup vessels were served along with real cooked bat. Different varieties of soups along with wild animals, eggs, meat and complete body, roasted cobra, roasted legs and hands of wild bear, etc. were served at several costly restaurants in China. The animal market used to sell rats, cats, snakes and endangered species of birds. This is all happening in China when Chinese people were already known that 70% of infective viruses were originally from wild animals. After coronavirus widespread, the China government has banned the illegal business of wild animals to prevent it from spreading further. According to World Health Organization, almost 18 years back, dangerous viruses like SARS and MERS were also transmitted from bats before being transmitted from civet cats and camels, due to which in the year 2002 and 3 more than 700 people got died and thousands got infected. World Health Organization has given coronavirus a name called COVID-2019. The health authorities of every country have decided to stop the transmission of virus, and it has become a big challenge now. However, China is trying hard to control its spread. Outside China, nearly 22 countries like Thailand, Iran, Italy, Japan, Singapore, South Korea, Australia, Malaysia, America, France, Germany and United Arab Emirates has confirmed many positive cases of coronavirus. Today, India has confirmed 6 positive cases. The infected patients were under the constant observation and kept in isolated quarantine areas so that infection should not be spread in other areas of country. Public health responses in China and around the world have included China travel restrictions, quarantine and curfews. As a result of outbreak, many countries and regions, including most of the Armenia, Australia, India, Iraq, Indonesia, Kazakhstan, Kuwait, Malaysia, Maldives, Mongolia, New Zealand, Philippines, Singapore, Sri Lanka, Taiwan, Vietnam and United States have imposed temporary entry ban on Chinese citizens or recent visitors to China, or have ceased issuing visas and reimposed visa requirements on Chinese citizens. Now let us talk about the signs and symptoms of coronavirus. Those infected may show any symptoms or develop symptoms such as fever, dry cough, fatigue, sputum production, shortness of breath, sore throat, headache, muscle pain or joint pain, chills, nausea or vomiting, nasal congestion, diarrhea, hemoptysis and conjunctival congestion. Further development can lead to severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock following death. Some of those infected may be asymptomatic, returning test results that confirms infection but show no clinical symptoms. Individuals with close contact to confirmed infected patient should be closely monitored and examined to rule out infection. The time between infection and symptom onset ranges from 1 to 14 days, though it is most commonly 5 days. However, one case is reported having an incubation period of 27 days. Now let us talk about the transmission, how this virus is transmitted. The virus is most likely transmitted from an animal to human through the animal involved and the mode of transmission. The primary mode of transmission is through the human to human transmission via respiratory droplets that people exhale, such as coughing and sneezing. Furthermore, these droplets can fall on surfaces, including tables, telephones, mobiles, desks, so people are able to catch COVID-19 virus if they touch a surface that has been contaminated by the virus and then touch their eyes, nose or mouth. Droplets transmitting coronavirus only stay suspended in the air for a short time, and it is assumed that they are similar to other coronaviruses which may stay viable and contagious on metal, glass or plastic surface for up to 9 days at room temperature. Disinfection of surfaces is possible with substances such as 62 to 71% of ethanol applied for 1 minute. The virus was reported to have been able to transmit down a chain of up to 4 persons, which is similar to severe acute respiratory syndrome related coronavirus. The World Health Organization says that possibility remains open as meat and animal product should be cooked thoroughly as a rule of thumb. Milk used to be always pasteurized. A person is considered to be at risk of having COVID-19 if they have traveled to an area with ongoing community transmission within the previous 14 days or had a close contact with an infected individual. Now let us talk about the diagnosis. United States and China has developed a diagnostic kit. The test kit is real-time reverse transcriptase PCR panel designated for research use only. The World Health Organization has published several testing protocols for SARS-CoV-2, the virus that causes COVID-19. Testing uses real-time reverse transcriptase polymerase chain reaction. The test can be done on respiratory or blood samples. Results are generally available within few hours to days. An alternative method of diagnosing is based on a clinical presentation such as looking for visual signature patterns of COVID-19 in CT scans of lung. Signs of pneumonia may precede confirmation of COVID-19 infection through PT-PCR test. Now let us talk about the prevention. Prevention can be majorly done by hand wash. Individuals have been asked by health authorities to maintain good hygiene by washing hands when appropriate and to avoid touching the eyes, nose or mouth with unwashed hands. The health authorities are also warning the individuals to wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when the hands are visibly dirty, before eating and after blowing one's nose, coughing or sneezing. Wash your hands completely with soap thoroughly first. Wash your hands properly at the back, between the fingers and under the nails and till the elbow for at least 20 seconds. Do not share food. Even do not share utensils. Wash your hands with soap before you eat and after being out in public. It further recommends using an alcohol-based hand sanitizer with at least 60% alcohol when soap and water are not readily available. World Health Organization also advises individuals to avoid touching the eyes, nose or mouth with unwashed hands. Now, use of tissue. Health bodies recommend that individuals cover their mouth and nose with a tissue when coughing or sneezing, which should be disposed of immediately. Or you can even cover with a sleeve. If a tissue is not available, coughing and sneezing into a tissue, throwing the tissue directly into the dustbin, and wearing surgical mask if you think you will be coughing or sneezing in public. Now, usage of face mask. The use of surgical face mask by those who may be infected has also been recommended, as they can limit the volume and travel distance of expiratory droplets dispersed when talking, sneezing and coughing. Use of mask in home and healthcare environment, including that they be securely tied to minimal gaps between the face and mask itself, and that the mask should be replaced when they become damp or humid. The user should not touch the front of the mask when removing it, washing hands with soap and water, or using hand sanitizer after removal. Or if a used mask is touched, and that single-use mask be disposed of immediately after they are removed and are not reused. Mask has also been recommended for those who are taking care of someone who may have the disease. Those who may have already been infected are advised to stay at home except to get medical care. Wear a face mask, especially in public. Now, sharing personal household items. Cover coughs and sneezes with a tissue. Regularly wash hands with soap and water and avoid sharing personal household items. However, sometimes a sick person's saliva can get onto other things like their hands, doorknobs, train straps, pens, digital devices, chopsticks, mouse, tissue, cups, lift buttons, stair banisters, and even on the outside of your face mask. And if you touch any of these things by accident and unknowingly, then touching your face, rubbing your eyes or your loved one's eyes or face, then you might all fall sick. Viruses can last up to 24 hours on objects, and the only effective way to get rid of them is to wash them off with soap. Now, another measure or prevention we can take is self-isolation. For those who suspect they have been infected, are advised to restrict activities going outside the home, except for getting medical care. Do not go to work, school or public areas. Avoid using public transportation, ride, sharing or taxis. Those seeking medical care are advised to call ahead before visiting a healthcare provider. The most commonly used length of these periods have been 14 days or 2 weeks, as it is also estimated time frame between the infection and onset of symptoms. Now let us talk about the vaccines. There are no vaccines currently available, but several organizations around the world are developing vaccines. China and Hong Kong are trying to develop a vaccine for it. They hope to have vaccine in trials by June 2020 and approved and ready in a year. The US National Institutes of Health is hoping for human trials of a vaccine by April 2020. Now let us talk about the disease management. There is no treatment presently as the research is going on, and scientists are also in process of making a vaccine and looking for possible medication. Attempts to relieve the symptoms may include taking regular over-the-counter cold medications, drinking plenty of fluids, and resting. Depending on the severity, oxygen therapy, intravenous fluids, and breathing support may be required. Some countries require people to report flu-like symptoms to their doctors. Several compounds which were previously approved for treatment of other viral diseases such as favipiravir, ribavirin, remdesivir and galidesivir are being investigated as potential drugs against the coronavirus. Bruce Alvarez, an Assistant Director General of World Health Organization, has stated that there is only one drug right now that we think may have real efficacy, and that's remdesivir. Trials are also in progress and results could be available within a few weeks from now. So be safe, be alert, and take the best care of yourself. Do like, share, comment, and subscribe. And do not forget to press the bell icon to receive the notification on addition of new videos. Thank you.